Hello, welcome to the StellaLife Innovator series. I'm Liz Lundery, and today I have the pleasure of speaking with Dr. Jessica Lederhausen. Dr. Lederhausen is a dentist, a public health advocate, a lifestyle coach, as well as a speaker and the author of the book Oral, the Swedish Secret to Full Body Health Starting in Your Mouth. She believes that small changes in how we eat, sleep, breathe, and move can improve our oral and overall health. Dr. Lederhausen's guide for balanced living is based on these four pillars of sustainable health and is known as the Lagom Method. Welcome, Dr. Lederhausen. Thank you for joining me today.
Well, hi, and thank you for having me. This is very exciting.
I am excited. I want to learn more, about your method. And so I'd like you to tell us about that. Tell us about your mission and what has shaped your journey.
I'm from Sweden, where I became a dentist after a short career as a professional golfer,
Oh,
which shaped me a lot. So when you said what shaped, you ended asking the question, which shaped me, I thought that really shaped me. So I want to mention that. And I brought some research in mobile dental care, where I looked at barriers to health, which led me to my master's in public health epidemiology. I landed in coaching because I thought I've lived a longer life than, and I had so much experience with different things. And I thought put it all together would be neat, which took me a while. And I got distracted with running and founded TEDx Chicago,
mm,
which was fantastic. So I led a large group of people. We put up these events with TED speakers come to us, and we found the speakers and we coached the speakers. And I got very inspired by their diving deep in something they cared about,
mhm.
which made me think more and more, what do I really want with this coaching, which led me to my book, because I was talking around three of the four pillars I have in the book with my coaching. And then I realized one day, it all starts in the mouth. And here I am, a dentist. Why don't I see that? Because all these other things affects your mouth and then also your overall health. So that was how I came to where I am today, I would say, in a short version of it.
Well, it's quite a journey, and you have such a broad perspective and so much experience, on many levels with health and with your coaching. I'm sure you're also dealing with people's emotions and other things which are also related to those pillars, right? With nutrition and rest and everything else. Through this, what is your perspective on that oral connection to overall health, the oral health and the overall health connection?
Well, yeah, as always, I think about things, I guess. And then I think we are disconnected in a few ways. So we are disconnected between medicine and dentistry. We're disconnected between the patient and the doctor. And I think the worst thing is that we're disconnecting the head from the body. I mean, we think we can do anything with your mouth, and it's as if they're parts of a car or something.
Yes.
And so that's the underlining view I have on the mission I'm on, which is, I guess, to communicate with doctors and with patients. So I talk to both sides or both groups in different ways, but the thing I really landed in is I hope that we can bring in all the new information we have with the microbiome this is new information that we just learned the last 10, 12, 15 years.
An emerging
And I
field.
know everything. Yeah, it takes time. I know that. But then you have patients who come to dentists and they read something about something called oral microbiome. And if I had a clinic today, which I don't, I would be embarrassed if my group would not have an answer to the question. And I'm not sure we all have an answer, or the group have their answer, at least, how they work with this and incorporate what we're talking about. So that's one way I'd really like to be out and speaking, which I'm just kicking off. And otherwise, I like to empower people to ask the right questions at the dentist office.
Yeah.
So yeah, so I better hurry up training the dentist, I guess. Okay.
Yes.
That's just
Yeah.
so they have the answers.
I've
Or
been
no one might have an answer, but at least understand the question,
Right,
what to
right.
do with it.
And I so agree with you on this compartmentalization of, this here and, it's like separate entities. And in the American healthcare system, there's been ongoing now conversations and criticism of how there are all these specialists and they don't communicate with each other, and patients are taking multiple medications that one doctor is not aware of. So and in
Yeah.
dentistry, it's again where all the mouth is part of the rest of the body, and if people are having other health issues, we see that reflected in their mouth
Yes,
as
it's
as
fantastic.
dentists and hygienists and clinicians all the time. So really recognizing that and keeping that in mind as we come up with our treatment plans. So, your approach with this balance of all of these things that we do every day, so they are balanced, is incredibly important. What would you say is like the most important lesson that you've learned along the way?
Well, the biggest lesson I've learned is that you can have it all, meaning but you have to decide what your all is.
Mhm.
Because there's so much noise around us, what you should be or what you should do when it comes to careers, health, level of exercise or no exercise. And some people then say, I can only do this, I can't do that. But I think it's been a debate for years going on with Anne-Marie Slaughter, and her husband had articles out in regards of this. And I think it's a worthwhile thought, even bring to your health. I mean, I think you can have all, but you have to decide what your all is. It's my
Yeah, and
definite.
it's very individualized, right? So just as our treatment planning should be in dentistry. So when you're talking about the oral microbiome, it's this emerging field. And, now we're having ways of testing, what bacteria are present in the patient's mouth. And we have so much technology, but, how to integrate that and
Yeah.
present to the patient. I think that's the challenge because we're all on having a learning experience right now as the technology and the research evolves. So StellaLife, absolutely. We do have this respect for the oral microbiome as we're learning how really important these bacteria are. And then again, with people's health plans, everybody's an individual, and has different
Yeah,
needs.
but my answer was maybe more whole life
Yeah.
answer, but I think it's the same for obviously every part of your life. So
Yes,
it
yeah.
wasn't as precise as you wanted. But my learning with the dental, like you mentioned, the microbiome, the genome project, and all that, I think is remember that when I wasn't around them, or you were not either, when they learned that smoking was dangerous or you got sick from smoking,
Yeah.
it took 50 years from that. There was a whole writing, a whole deck. I mean, it was a thick book written about it. I don't remember, it was in the 50s. I don't remember exactly the year, but it took 50 or 40 years before things were implemented.
Yeah.
And still people are smoking, and that's okay, I guess, but it's not okay that we don't, it takes this lead time between the knowledge and the action is a little slow.
Yes.
That's what I'm trying to take in and learn from in regards to the microbiome.
Yes. Yeah. It's
So they
easy.
might take it some time.
And people like us can get impatient because we want to see some rapid progress there because of
Yes,
our
yes.
awareness. But yes, that's why we're trying to educate each other, and learn on our own as we carry
Yeah.
on.
And another thing I'm thinking of is that we like to compartmentalize. So either you're integrated or you're functional or you're whatever. I hope we can all agree on integrating everything depending on the patient's needs
Yes.
more. So we are not so focused on saying that the way I do it is the best way or it's the right way. It's more, and I think that is happening, but it's again a little slow.
Yeah, and part of that too, I think is so important to actually listen to the patient and give them a chance to talk so you can find out more about their lives, because we tend to do all the talking. This is what you need
Yeah.
to do, this is what you've got, but we can be more helpful to them if we can, again, make it more individualized based on their specific needs
Yeah.
and lives. So, yeah. Do you have three tips that you can share with us that we can, do so we can improve our own health?
Yeah, let's do one per each pillar. So my pillars are breathing. So my best tip is to try nose mouth taping to see if you are a nose breather or not, because most people are mouth breathers, but most people think they're nose breathers. So try it, and if you're uncomfortable, it means you need to practice your nose breathing by using tape, for example. For my sleep pillar, the best tip is to take it seriously and actually go to bed. And remember, the circadian rhythm is, you can't control that. So if you need to sleep, we all need to sleep. When it comes to eating, I think the quickest tip would be to stop snacking. I think that would be most people would benefit from that idea. I don't say what to eat stop snacking. Don't eat after dinner.
Yeah.
But that's two things, but similar. And then moving, my best tip there is to say, I would say, is whatever makes you happy, that is a movement, please do it. Make sure you do it.
Yeah, that's beautiful. I think those we can definitely easily apply those, do whatever type of movement you like, whether it's taking a walk outside or, whatever your routine is, but then being consistent with it. So you're always feeling good, so I think it's about feeling good. So thank you so much for sharing your perspective, and I'm eager to see the book, and I want to make sure our listeners can have that. We're going to have links available so that you can check that out. Thank you so much. And please continue your work. And I'm really looking forward to, hearing about you and your ongoing contributions, so that all of us can, help others so we can have a healthy society overall. So thank you, Dr. Lederhausen. Really appreciate it.
Fantastic. And thank you so much. It was lovely meeting you.
You're very welcome. Thank you, everybody, for joining us today, and looking forward to seeing you next time on our next Innovator series. Please live in balance and stay well. Thank you all so much.